Hello everyone, and welcome to today's webinar entitled Minimum Floor Price Laws, an Emerging Strategy to Reduce Tobacco-Related Socioeconomic Inequities. We are excited that you are all able to join us today. I am Derek Carr, and I'm an attorney with ChangeLab Solutions, and I'll be serving as the moderator for today's webinar. I'd like to start out with a few housekeeping announcements. First, this webinar is being recorded and will be available for download from our website in about a week. Also, all participant lines have been muted. If you have a question for one of our presenters, please feel free to type your questions into the chat box on the lower left corner of the screen. We will try to answer as many questions as we can during the Q&A portion of the webinar. If we run out of time and haven't answered all of the questions that we receive, we will contact you via email with a response to your question. ChangeLab Solutions works across the nation to advance equitable laws and policies that ensure healthy lives for all. We prioritize communities whose residents are at highest risk for poor health. Our interdisciplinary team of lawyers, planners, policy analysts, and more works with neighborhoods, cities, and states to create thriving communities. Now, just a quick disclaimer. The information provided in this webinar is for informational purposes only and does not constitute legal advice. ChangeLab Solutions does not enter into attorney-client relationships. Today's webinar will consist of two presentations followed by Q&A. I would like to begin by briefly introducing our two presenters who we're honored to have with us today. First is Shelley Golden. Shelley Golden is an assistant professor in the Department of Health Behavior at the School of Public Health at the University of North Carolina at Chapel Hill and a member of the UNC Lineberger Comprehensive Cancer Center. Her research focuses on the political and area-level conditions in which individuals and policymakers make decisions that impact population health. Most of her current work focuses on tobacco product price policies, especially those implemented at the state and local level, and other aspects of the tobacco retail environment. Dr. Golden received her Bachelor's of Science in Biology from Yale University and her Master's of Public Health in Health Behavior and Health Education, as well as her doctorate degree in Public Policy from the University of North Carolina at Chapel Hill. Shelley will be providing attendees with an overview of tobacco minimum floor pricing policies and a preview of some innovative modeling research on the potential of minimum floor price laws in California tobacco control. Next, we have Erin O'Malley. As a legal fellow at ChangeLab Solutions, Erin works on issues related to air and water quality, healthy city planning, violence prevention, and tobacco control. Before joining ChangeLab Solutions, Erin worked for the Missouri Commission on Human Rights and is a research fellow on projects relating to disability and health. In law school, she was involved in a grassroots policy and advocacy program and worked with the Missouri State Legislature to expand access to health care. She received her BS in Political Communication from the University of Texas at Austin and her JD from St. Louis University School of Law, where she was managing editor of the Journal of Health Law and Policy. Erin's presentation will provide some additional background information, identify relevant legal, public health, and equitable considerations in designing minimum floor price laws, and discuss lessons learned from jurisdictions that have already adopted such policies. So with that, I would like to once again thank our presenters for their participation in today's webinar and for sharing their expertise with us. And I would like now to turn it over to our first presenter, Dr. Shelley Golden.
Thanks, Derek, and thank you so much for inviting me to present today. I'm looking forward to presenting, hearing what Erin has to say, and then hearing questions from the crowd. So I will start by just reminding all of us that I think it's a pretty established idea in tobacco control that raising the price of cigarettes is considered to be a particularly powerful strategy for reducing tobacco consumption. And also possibly for reducing socioeconomic disparities in smoking and alleviating the health and economic burden of tobacco-related diseases. And most of the time when we think about raising tobacco prices, we focus on using excise taxes. In addition to reducing tobacco consumption, excise taxes, of course, raise revenue for the taxing government. And sometimes those funds are actually directed back into tobacco control, and therefore the sort of public health benefits of the tax can be even further extended. But certainly everybody in California knows that raising taxes can be politically challenging, and despite or maybe because of the recent success in that on the state level, it may not be the best or the most likely target for increasing prices in the immediate future. And furthermore, beyond that, we also know that from tax increases in other places that the tobacco industry usually employs workarounds in the face of tax increases to keep at least some prices low for some consumers. So I want to talk today, or what we're going to all talk about, is an alternative, potentially complementary pricing strategy to excise tax laws called the minimum floor price. A minimum floor price law is a law that sets a price below which a product, in this case a tobacco product, can't be sold. And it's, Erin may talk about this more, but it's often recommended to be sort of implemented in combination with a ban on discounting so that sort of you can't undercut that floor price with coupons or other discounts. And given that there's some evidence that some groups like young adults, African Americans, may be more likely to use price discounts and or buy particularly cheap products, we think there's some chance that minimum floor price laws could have a pro-equity effect. In general, non-tax price policies like minimum floor prices are work a little bit differently from the way that excise taxes do, and so might have different results. So on this slide, you'll see a general sort of depiction, a simplified depiction of a tobacco pricing market. And so if you think about within any given tobacco product category, there might be price tiers, things like discount products on the left to more expensive types of premium products on the right. And then within any of those categories, you're going to have different brands or different pricing so that there's sort of a range of price variation within each of those tiers. And so the sort of that dark gray bar in there might be a way of thinking about what prices might be for a particular tobacco product before you implement a policy. Now thinking about how that might play out, I'm going to do an illustration on the left of what this might look like for excise taxes, and on the right for what this could look like for floor price laws and how it might change this distribution of prices within the market a little bit differently. So starting with excise taxes, the blue now represents what we might expect after an excise tax. So an excise tax is designed at least to raise all prices by a certain amount, shifting that dark gray sort of bar equally upward. It doesn't always maybe look exactly like that in practice, but that's the conceptual understanding of what happens in an excise tax. A floor price, on the other hand, sets a price below which the product can't be sold, and so ends up with a sort of differently shaped pricing market at the end that, if it's set high enough, could at least reduce or potentially eliminate very cheap prices within the market, but may leave some of the more expensive prices relatively untouched. So in a recent study, my team used information about smoking behavior and how much people report paying for their cigarettes from a national survey, the 2010 to 2011 Tobacco Use Supplement of the Current Population Survey. And we projected changes in prices and smoking under different floor price levels. Those floor price levels were set to correspond to slightly below to slightly above average prices within each state. And we did this separately for individuals below versus above the median household income level. So we found, not surprisingly, that the higher you set the floor price, the more average prices would actually increase, and the more smoking would decline. But we also found that this was more true for lower income smokers, which are sort of illustrated in the lighter blue color, compared to higher income smokers illustrated in the darker blue color. And this difference is really because lower income smokers were more likely to report paying lower prices to begin with, so they were more likely to be sort of in that part of the pricing distribution to the left, and therefore more likely to be more strongly impacted by the law. So currently we're in the midst of a project to try to build sort of some similar floor price projection modeling for folks in the state of California. And specifically, our goals are to think about local floor pricing laws. So to identify different floor price options for local jurisdictions that are somewhat tied to what local pricing is in those areas. And then to think about for each of those floor price options, how do we think the implementation of that would impact smoking prevalence as well as cigarette consumption among people who continue to smoke? And then provide some insight into how those floor price laws might influence disparities in smoking. We're also hoping to make this into a tool that's hands-on and illustrative for folks working at the local level. And we take our inspiration from the Tobacco Control Policy tool, which you may have seen, put out by the Lung Group of the Cancer Intervention and Surveillance Modeling Network. And so that's a tool that, for example, lets you plug in this case, some information about sort of a starting price and a proposed increase in taxes. This is their tool for taxes. And then when you do that, it spits out information about what the sort of predicted prevalence would be. So our vision was to do something similar for California, where you would be able to choose a sort of county or a city jurisdiction in a particular year and get something spit out, for example, that would give you, and this is just example information, not fully representative of data we've run yet. On the left, different floor price options for a particular county. And then on the right, you see sort of some projections of how we think prices might change and some projections of how we think smoking might change. Now, our goal is to do this on the local level, but to sort of develop our model, we implemented a statewide model. And I'm going to briefly share some of the results that we have there, just so you sort of get the sense of what this tool will ultimately look like. So this is the modeling we're doing is in a category of models called micro-simulation models, which basically means you sort of build a data set based on sort of real-world information, but then you use that data set and you make some assumptions and you do some manipulations and you look at sort of how the people in your data set will respond to a particular change, in this case a policy change. So we start by creating a simulated population that looks like the state of California in terms of its demographic makeup. So we sort of create people and give them various demographic categories. And then we know that demographic characteristics are really important predictors of both smoking likelihoods as well as how much people report paying for the cigarettes that they purchase. So these two graphs are based on data from the state of California around variation in smoking prevalence by demographic groups, as well as on the bottom from reported pack price data from respondents for the California Burfus data. So given that we know that demographics are tied to smoking likelihood as well as how much people report paying, we go back to those simulated people that we created, and based on their demographic characteristics, we assign them sort of initial smoking, whether they smoke or not, and we also assign them a starting price for what we think they probably pay for a pack of cigarettes. And then we adjust these prices. So we were using the 2014 to 2016 California BRFSS data initially because that's what was available when we started this project. And as you all know, you all have implemented a $2 tax increase since then. So we figured the reported pricing data is now outdated, and so we adjust those prices upward. And then eventually when we do this for local California communities, we'll also adjust pricing for sort of the local areas based on the Healthy Stores for a Healthy Community store audit data, where people go in and identify the cheapest price for a pack of cigarettes, for example, in a given store. And then we make an assumption in this model that people respond to a price increase by reducing their consumption. And we use a sort of standard estimate for this price responsiveness that's derived from the literature. We assume that sort of a 10% price increase is associated with a 4% reduction in cigarette consumption. So we identify different floor price options then are tied to the starting prices in the sample. So we look across those range of reported prices, and we come up with some floor price options that are sort of just below the average reported prices, and model a couple that also go a little bit to moderately above those average prices. And then we assume that once a floor price is put into place, individuals who were previously paying below that floor price would now pay the floor price, and that those who were previously paying more would still continue to pay the same amount because they wouldn't be impacted by the policy. That said, our model also takes into account different possible amounts of policy avoidance. So we know that people might opt to travel somewhere else to buy cigarettes to avoid a floor price or find there other ways around a policy, and we take that into account. So then based on how we assume prices change for everybody, we use that assumption I listed on the last page about how people respond to prices to project how we think their smoking and their cigarette consumption will change. And so here are some results out of this full California model. So you'll see that we sort of have an initial average price of $8.40. And we project a slight increase in prices if we implemented a floor price of only $7. So it wouldn't affect that many prices, but it would knock up our average prices by just a little bit. On the right-hand side of the slide, you'll see that higher floor price levels, something around like $9.50, so a good bit above now that average, would raise prices by up to $1, even if we assume, as that sort of lime green line does, that about 15% of smokers are avoiding those new prices. So this is what we would expect might happen to prices. The next slide shows what we might expect would happen with smoking prevalence. And so here what you see, again, is that a very slight change in smoking at a relatively low floor price, and pretty similar regardless of whether or not, whatever assumptions you make about avoidance, because not that many people are really being affected. But by the time we get over to that $9.50 price point for the floor price, we're seeing a drop in smoking prevalence by about between 0.2 and 0.3 percentage points for if we assume no avoidance, and by closer to 0.2 percentage points even when we're assuming a more substantial number of people are avoiding the policy. And then finally, we are also modeling what happens to the folks who remain smokers, but we assume they also cut back. And so this graph shows monthly cigarette consumption and number of cigarettes, and we see a drop, at that high end of the floor price market of about, about 10 cigarettes or so, give or take, per month in terms of a change in cigarette consumption among people who continue to be smokers. So like I said, we started with a state model, but in some of our next steps we want to take this to the local level, and I just want to briefly note why local models are important. So I started by talking about how demographics drive some aspects of behavior and pricing, and different parts of California have different demographic makeups, so we want to take that into account. In addition, we know that I'm sure you all could tell me that in different parts of California, pricing is really different. So this just shows a couple of counties, and this is reported price data from before the tax increase. So different counties can have markedly different pricing markets to begin with. So taking those things into account is important. So what we're doing next is, as I said, sort of trying to work on how to simulate this for local areas. We also want to build an equity component in, and so we're going to sort of come up with models that allow us to compare how we think these things might affect different demographic groups. And then the staff at the California Tobacco Control Program are currently working with our data and our analyses to develop an online tool that will make this work accessible to local folks working in tobacco control. And we're looking forward to the unveiling of that in the relatively near future. So I just want to give a big thanks, especially to the rest of my team here at UNC, and also to Derek and Pratima at Change Labs for supporting this work. And with that, I want to leave my contact information here. You're more than welcome, obviously, to ask me questions in the webinar today, but if you'd like to follow up afterward, I'm happy to answer emails. And then my final slide just lists some resources if you're interested in sort of some of the national work on floor price laws. So with that, I think, Derek, I'm wrapping up my part and happy to hand it back to you to pass on to Aaron.
Great. Thank you so much. That was very informative and super helpful. I just want to remind folks that if you have questions about any of the things that are being presented, please do submit them through the chat box, and we'll get to them during the Q&A session. And also that the slides and the recording of the webinar will be available online in about a week. So if you missed anything during Shelley's presentation or missed anything during Aaron's upcoming presentation, you'll be able to retrieve that as well as links to those studies that Shelley mentioned. So with that, I would like to turn it over to my colleague, Erin O'Malley.
Thank you, Derek. I'm excited to talk to all of you about this because, as Shelley pointed out, we're learning a lot more about these policies and the impact they can have on advancing health equity and tobacco-related health equity. Today I'll cover why we're focusing on tobacco pricing policies in the first place. I'll then talk about the different types of tobacco pricing policies and the pros and cons of each. Then I'll highlight some of the equity, legal, and public health considerations to keep in mind when designing, adopting, and enforcing tobacco pricing policies. And then I'm going to end with some of the resources and services we have available here at Change Lab. So why are we focusing today on tobacco product prices? The tobacco control movement has made really incredible progress in reducing smoking rates and tobacco-related harm over its 30-year existence. Unfortunately, and as many of us know, these gains have not been evenly distributed across the population. There are still stark racial, socioeconomic, and other disparities in tobacco use and tobacco-related harms, and these disparities have persisted over the years. We have been able to narrow some of these gaps, but some of these disparities have grown larger over time, including disparities based on socioeconomic status. Here we've included information on disparities in California, and unfortunately these trends are not unique to California. Similar inequities across race, sexual orientation, geography, education, and other demographic factors exist across the country. So two things are clear. Our work is far from complete, and we must be deliberate in choosing tobacco control strategies that effectively address these inequities. So returning to that central question of why we're focusing on price, there's still widespread availability of cheap tobacco products. For example, nearly 90% of tobacco retailers in California sell Swisher Sweets for less than $1. And we also know price discounts are a core strategy in the tobacco industry's playbook. Price discounts are the tobacco industry's single largest marketing expenditure, and this accounts for 83% of their spending in all marketing, and that was from 2016. This includes $380 million on coupons for consumers and almost $8 billion on price discounts and promotional allowances for those who sell tobacco. Over the years, we've learned a lot about predatory targeting of underserved communities with promotions and discounts. So while pricing strategies are effective at reducing tobacco use and related harm across all populations, the evidence is clear that pricing policies can produce outsized benefits for many priority populations. And to say that another way, These policies produce greater reductions in tobacco use and related harm among many priority populations than they produce across the population as a whole. In the case of higher rates of use for people of certain socioeconomic statuses, a study looking at the impact of tobacco control interventions found that price increases were the single most effective policy strategy for reducing these inequities. We don't just have to rely on studies either. Evaluations of tax increases and other pricing-related interventions prove that these policies work. So we know that pricing policies work as a general matter, but what types of policies are most effective? Until fairly recently, tobacco pricing policies were created almost entirely at the state and federal level. These policies generally took one of two forms. The first is what's referred to as minimum markup laws. These laws require products to be priced at least a certain percentage above the wholesale cost. About 25 states still have some form of these markup laws on the books. We don't recommend that communities pursue this type of policy because these laws are designed primarily to prevent anti-competitive behavior, not to protect public health. Also, the efficacy of these policies is mixed, in part because they still don't protect against industry price manipulation. And finally, these policies can be difficult to enforce. The second policy is excise taxes, which are the gold standard for increasing the cost of tobacco products. Every state, D.C., and the federal government impose excise taxes on cigarettes and other tobacco products, and many states now have e-cigarettes. These taxes provide critical funding for public health programs and other government services. Unfortunately, state law in California and many other states preempts, that is, prohibits, local governments from enacting local tobacco taxes. This means the only way to increase tobacco taxes in California or any other states like it with preemption laws on the books is at the state level, and this typically requires a ballot initiative. This is one of the reasons why Missouri's tobacco tax is still set at 17 cents a pack, which is the lowest in the United States. Even though pricing policies are limited at the federal and state level, there's plenty to be done at the local level. Local communities can establish minimum floor prices, which is one of the most important and effective interventions of the three we're going to talk about today. Communities can also prohibit the redemption of coupons, discounts, and promotions, or they can establish minimum price package sizes. Both of these last two policies increase the efficacy of minimum floor price policies and help to ensure compliance. Minimum floor price laws set a minimum price for tobacco products. A tobacco company, wholesaler, or retailer could not sell a product for less than the minimum price set by the policy. For example, Sonoma County became the second jurisdiction in the country after New York City to adopt a minimum floor price law. Sonoma County prohibits the sale of cigarettes, little cigars, and cigars for less than $7. New York City recently raised their minimum floor price for cigarettes to $13.50 a pack, and this will soon increase to $15. Studies have shown that minimum floor price laws may actually be even more effective than excise taxes at reducing tobacco-related inequities. And this is because they target cheaper products on the market that are disproportionately used by youth and some priority populations. Because retailers get to keep the extra money from the increased prices, there is less political pushback because of lost revenues or concerns about government overreach. People do tend to be fine with the government overreaching if they get to keep more money because of that. This policy is more like three policies in one, but they're generally lumped together. This policy requires retailers to establish a set retail price for each tobacco product and then prohibits retailers from accepting coupons allowing for the purchase of tobacco products below that base price, selling tobacco products via any type of discount or promotion that drops the price below the base price, or giving away anything for free or at a discount with the purchase of any tobacco product. So this would prohibit things like buy one pack, get one free. The purpose of this policy is to eliminate price discrimination by establishing a uniform pricing policy. This undercuts the tobacco industry's ability to capture more price-sensitive consumers, such as youth and people with lower incomes. Oakland was the first city in California to adopt this policy, and our neighbor Alameda recently passed their own policy. Many of you are likely familiar with minimum package sizes. It's the most common pricing policy at the local level here in California, and it's an important one. It may seem counterintuitive to force people to buy even more tobacco. To use West Hollywood's policy as an example, the idea behind the policy is that by requiring little cigars, in their case, to be purchased in a package of 20, the cost for that will be higher than a single little cigar, so it creates a barrier to purchase. This policy is especially effective for youth who may not have as much money available. The industry has continued to sell cheap products even in jurisdictions with minimum price package size policies. And in some cases, this is because the minimum size wasn't set high enough. In other cases, this policy hasn't been as effective because the industry is willing to take a financial loss in order to gain new customers. But minimum package sizes remain an important policy option, and they're also very helpful for enforcing minimum price policies because they create a standard package size to price. Now that we've covered the basics of what the three main policies entail, what are some of the equity, legal, and public health considerations to keep in mind when pursuing or enforcing these policies? The tobacco industry has consistently and perniciously targeted its products disproportionately to low-income communities, communities of color, and youth. This contributes to tobacco-related harm being experienced disproportionately, that is regressively, by these communities. From an equity perspective, it's important that we acknowledge and own that tobacco pricing policies are regressive, meaning that low to moderate income individuals pay a higher percentage of their income towards increased prices than higher income individuals would. This can impose significant financial burdens on low-income smokers. And to the extent that low-income smokers continue to smoke, higher tobacco prices decrease their purchasing power for other goods and services that are needed for their daily lives. And we can't avoid or try to bury that truth. Despite the fact that these policies are regressive, they still are beneficial and can promote equity. Because increasing the price of tobacco products has been shown to reduce consumption significantly, will provide disproportionate health benefits to low-income communities. Further, these policies can help ensure income is going towards products that actually contribute towards the health and happiness of members of these communities and not to tobacco companies. And of course, as with all policies, we must remain mindful that they are enforced equitably. This includes considering things like people's ability to pay fines, the impact of a person's immigration status, and the broader context of the current and historical targeting of many communities by police. Policies must be enforced rigorously, but it's imperative that we ensure that enforcement doesn't create new inequities or exacerbate existing ones. From a legal perspective, the biggest thing to be wary about when trying to pass these policies is the First Amendment. The key thing to remember when working on pricing policies is to focus on prohibiting conduct rather than speech. To use the coupon policy as an example, our policies prohibit the redemption of coupons, not the distribution of those coupons. Aside from this being more effective and easier to enforce, prohibiting the redemption means you're regulating the conduct of a commercial transaction. Just distributing coupons, on the other hand, can be considered a form of advertising, which is a type of speech protected by the First Amendment. So you insulate yourself from a First Amendment legal challenge by focusing on the redemption rather than the distribution of the coupons. Enforcement should also be a consideration when designing your policy. I mentioned earlier that minimum package sizes make enforcing minimum price laws easier. This is because the minimum pack sizes provide discrete units that you can base minimum price on. And finally, with minimum price policies, you want to make sure your policies include language to automatically adjust the minimum price annually based on inflation. This is very important and make sure that the effectiveness of the policy does not diminish over time. It's also important to consider these policies as pieces that all fit together to accomplish a larger task. They fill different gaps and protect against different industry tactics. While each can be enacted on its own and will certainly have important impact, this is truly a case where the full package is greater than the sum of its parts. So far I've talked about policies for the sale of cigarettes, little cigars, and cigars. The discount and coupon policy could apply more broadly, but the minimum package size and price provisions only address these specific products. This is because applying minimum package sizes and minimum prices to other tobacco products like smokeless and pipe tobacco is more challenging because of the significant variations in how these products are packaged and sold. E-cigarettes provide an even greater challenge because of questions over what you're measuring and what the unintended consequences of policies could be. For example, if you base the minimum price on a unit, say a single Juul pod, you may encourage those products to increase the nicotine content to provide a greater hit from a smaller quantity. If you base the minimum price on nicotine content, you have to figure out how to actually enforce that policy. None of these obstacles are insurmountable, however, and we'll no doubt see jurisdictions looking to adopt policies covering these products and hopefully blazing a path for others to follow. New York City did recently extend their minimum floor price law to cover more products, but it's a more complicated policy and will require more resources to implement and enforce. Local Law 145 was passed in 2017 and requires minimum prices and a tax for tobacco products and non-tobacco shisha. New York designed their minimum price to have a base price tied to the type of product with incrementally higher prices tied to any increases in amount beyond that. So here I've included a table showing two examples of how New York calculates minimum price for products that are not sold in packs. And as you can see, they also have minimum sizes, which they tie the base price of the product to. So now I want to talk about some of the resources ChangeLab offers to help with the creation and implementation of these and other policies. The first is our comprehensive tobacco retailer licensing model ordinance, which includes model language for all three of the policies that we've talked about today. You can also find a variety of guides, playbooks, infographics, and other downloadable resources on our website. And something I'm very excited about that just launched last week is our new health equity tool, a blueprint for change makers achieving health equity through law and policy. And this new resource presents legal strategies and best practices to help policymakers, practitioners, and communities improve health outcomes. You can also contact ChangeLab Solutions for technical assistance and trainings. We have partnered with many communities in California and beyond and look forward to helping even more communities adopt these impactful policies. Thank you, and I'm going to switch it back to Derek.
Thank you, Erin, for the wonderful overview of the different options available to local communities in pursuing strategies for increasing the cost of tobacco products and by doing so, reducing tobacco use and hopefully tobacco-related health inequities. I'm going to move on now to questions and answers, and I would encourage you all to continue submitting your questions through the chat box. We've gotten a couple so far, and we will continue to flag them as we go forward. And if you have questions after the fact, please do feel free to reach out to Shelley, Erin, or myself, and we're happy to respond by email or hop on the phone to chat. So the first question that I will direct to Shelley relates to the modeling research that her and her team have been doing, and its focus right now on cigarettes. And the question revolves around why the focus on cigarettes and whether it is possible to extend that model to other products like little cigars, and what some of the challenges might be in doing so.
Thanks, Derek. Great question. Yes, we are focused at the moment on cigarettes. And in concept, one could think about a modeling approach for a different product like little cigars. The challenge is that the way in which we've built a model, we're relying on previous literature about how people respond to changes in prices in terms of their product use. And there's a lot more research out there about how people respond to changes in cigarette prices than there are for other products. That said, there is some literature out there about response to other products, so we're looking into sort of how feasible we think it is, how strong that literature is, and whether or not it makes sense to try to build some modeling around that. Similarly, along those lines, even in the cigarette model that we're looking at, we're only looking at cigarettes as outcomes. One possibility is that A floor price law that only targets a specific product could also spur people to switch products, and we're not currently accounting for that in what we're looking at. But again, sort of with good research about how and when people switch prices, we're going to look into trying to build some of that into what we do in the future.
Great, thank you. And yeah, just to add up on that point on product substitution, it's a really important consideration to keep in mind when you're designing your pricing policies at the local level. As Erin mentioned, Change Substitution's model ordinance applies to cigarettes, little cigars, and cigars. And that little cigar component is really essential because of the kind of one-for-one substitution effect that we see between cigarettes and little cigars. For example, when the federal ban on flavored cigarettes other than menthol went into effect, we saw tobacco industry and tobacco consumers switch to nearly identical flavored little cigars. And so we don't just have that in the research, we have that in actual practice happening. And so it's really important to apply similar minimum pricing levels or minimum package sizes to those similar products to ensure that you're not just pushing people from one harmful product to another. The next question I have is about local tobacco tax preemption. And the question asks, Governor Brown vetoed a bill about local tobacco taxes. Is that the same thing as preemption? Could you clarify? And I'll take this one myself. So that is referencing back in 2016 when the state legislature enacted a whole slew of state tobacco control laws, including raising the minimum age to 21, extending the clean indoor air law to e-cigarettes, and closing a lot of the loopholes in that in the clean indoor air law. The legislature also passed a law that would have allowed local governments to impose certain tobacco taxes, and Governor Brown vetoed that bill. And that certainly relates to preemption. So, but it's not exactly the same thing. So, kind of going way back, ever since the first tobacco tax has been in place in California, put in place in the 1950s, that tobacco tax has said that this tax is being put on cigarettes in that case, and later tobacco products, in lieu of all other state and local taxes. So it was the exclusive tax. And so that was preempting the ability for local governments to impose additional taxes. And what that bill did was remove that provision in state law, saying that the state taxes were in lieu of other ones. So it would have repealed preemption. But by vetoing that bill and the state legislature not overturning that, it means that the preemption that had previously existed remained in place, and thus local governments continue to be preempted from imposing local tobacco taxes. And that will remain the case unless and until that state law is repealed. So the next question, which is related to the first one that I will give to Shelley as well, is if and how this modeling approach could be extended to other states outside of California.
Yes, so we've built a California-specific model and then are looking to do it locally on the California level. And one thing that's really nice about California as a big state is that it has really nice surveillance system and good data to work with. The approach is applicable in other places, and so I think it could be done in a different state, and the extent to which it's really nicely tied to sort of initial state pricing and initial state smoking information or cigarette consumption information is tied to the sort of strength of state or even better local data. So it's absolutely doable, and but with most modeling, it's also sort of based on the strength of the information that you have that you're putting into it.
Great, thank you. And I will follow up with that. Another question for you as well. So one of the common pushback that locals often hear from policymakers when they're pursuing these types of pricing policies is the potential to create an illicit market for these products. And I'm wondering whether you can speak to whether there is research out there on whether that is a legitimate concern or something that can be that we can provide locals working on these policies as a way to address those concerns?
Yeah, so that's a good question. I think a couple things to note before I directly answer the question is that I think all pricing policies are going to be subject to this critique and concern. And so while I'm not aware of specific research around the development of sort of the increase in illicit trade or black markets in response to floor price laws, which is partially because we don't have that many in place yet to study them, I think that information from sort of what happens following excise taxes could be useful. There is certainly concern about evasion and avoidance, whether it's through the development of black market or people just crossing borders and going elsewhere to buy their products. There's some great national work that looks at sort of in response to pricing policies, the extent to which that happens. And so I would sort of refer people to thinking a little bit about pricing policy in general for that. The one thing I do want to note that makes a floor price, however, different from a tax that could be useful in the political conversations is that we're not it's entirely likely that or possible that the increase in the price is something that actually would benefit the retailer. When we levy an excise tax, the money goes to the government, which is great for all the reasons Erin mentioned and other things, what we can do with that on a governmental level. But it is possible that the retailer will actually get to absorb some of the price increase in a floor price law. And I think a lot of local communities are often very concerned about how their local retailers will be economically impacted by tobacco control policies. So the second wasn't the answer to the question you asked, but something I wanted to add.
Yeah, absolutely. Thank you. So I have one last question that I'll answer myself, but please do continue to submit questions if you have them, or to follow up with us after the fact. And that question is the pros and cons of implementing pricing policies through tobacco retailer licensing versus as a standalone ordinance. And so I would certainly encourage everyone, whenever it is possible, to implement these policies through tobacco retail licensing. It really provides a framework for effective enforcement. It provides the funding in order to sustain that, and allows the local governments to really put penalties on the retailers that will encourage compliance. Fines are often they're great and they're one tool, but they're often seen as just the cost of doing business, whereas if you have the ability to suspend or revoke their license and take away their ability to sell tobacco products temporarily or permanently for a violation, they're much more likely to comply. And so while you can pass these policies as a standalone policy, it's not ideal, and certainly should not kind of be the default. The default should be to think about these in the context of TRL and to only use the standalone policies as kind of a last resort. And so that seems like the last question that we have. So thanks again to both Shelley and Erin for their extremely informative presentations. If you haven't already done so, you can reach out to us by email or phone with any questions that you have. And thanks so much for your time and participation today. We also hope that you will take the next minute or two to complete our webinar evaluation. It should pop up on your screen after the webinar ends. Thanks so much, and have a great day.